Hi everyone, today we're going to show you how to use a glucometer to check your blood sugar. So there's a lot of different types of glucometers on the market, but they all work basically the same. Within each kit, you're going to have a meter, a lancing device, and a lancet. And then you'll also get strips separately. So the very first thing you want to do before you poke yourself is wash your hands really good. You want to use nice warm water, and if you aren't somewhere where you can do that, you want to use an alcohol swab. So wash your hands with soap and water until they're nice and clean. The warm water is going to help your blood flow a little bit easier so you don't have to poke yourself as hard. After you've got clean, dry hands, we're going to get ready to poke ourselves. So in order to use your lancing device, you will pop off the cap, and then there will be an opening here where you'll be able to stick your lancet. So you want to stick your lancet in and push it down until you hear a click. That means it's loaded and ready to go. And then you're going to need to twist off the cap. You want to be careful because there is a needle under there. So twist off the cap and then recap your lancing device by popping this back on. And then you'll see here that there's a dial where you can change the number between 1 and 5. I've got it set on a 3, works well for most people, but if your hands are really calloused, you may need to go up to a 4 or 5. So we're gonna have our strip ready and put it in our meter. When we put it in, it'll turn on and give us some sort of signal, in this case a blood drop, that it's ready to receive blood. So we've got this ready. We're gonna poke ourselves and we're gonna then put a drop of blood here against the stripe on the strip. All right, so when you're poking yourself, you wanna go towards the outside of the pad of your finger and not right on the surface where you're touching things, so because it can get a little tender over time. So we want to go to the outside, and we want to make sure when we do this multiple times a day or every day, we're not always using the same spot. You want to rotate through both sides of your fingers, all 10 fingers, back and forth, so you're not repeating in the same spot over and over. So we've got a button here that's gonna eject the needle so we can get that blood drop. So we're gonna hold this up close to the skin, outside of the finger, and push down. So we heard the needle eject, and then we've got a little drop of blood forming. So we're gonna, you don't need a ton, but we wanna make sure there's enough. So we're gonna kind of just massage until we have a good size drop, and then we're going to hold it right up to that stripe, and it'll fill, and then it'll tell us what our blood sugar is. So then in order to get rid of the needle in here, we are going to use our sharps container, and we're going to eject the needle. Actually, first we got to take off the cap, and then we're going to eject the needle by pushing this lever forward. Into the sharps container. If you don't have a sharps container at home, you can use like a milk jug or a coffee can. You just don't want to put it in a garbage bag where it can come through and poke. And that's how you check your blood sugar.